Excited for another edition of Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave.
Well, we have lots to talk about today. Again, this could be about a 3-hour show, but we'll try and keep it a little under that. Let's talk about how we can thrive, not just survive. And we're going to start today with the mitochondrial health. And we're going to talk a little bit about that. We're going to talk about a hope story because you're getting somebody's mitochondrial health squared away. One thing I actually just recently did a little research on, I was blown away at how some pharmacy medicines affect the mitochondrial health. I was shocked.
You know, as we say, peeling back the layers, Dave, on looking at what could be driving the body's ability to roll back into balance and get into a state of less inflammation. A big part of what we try to do is really facilitate that mitochondrial activity. And again, it's that might, we've talked about it before, and you can do PubMed searches on it, mitochondria in any quote unquote different disease diagnosis, and you'll see all kinds of articles on it. And you can do the same thing even for pharmaceuticals that, again, we always talk, sometimes we got to take the good with the bad, and I'd still prescribe some pharmaceuticals when I think they're appropriate. I'm always looking at, does the net positive outweigh the net negative? And so, for instance, like a statin, I want to look at the number, which is a cholesterol medicine. I want to look at the number needed to treat for individuals. What's the relative risk reduction? And those are numbers that you should always be looking at to say, based on, because we talk about Framingham risk for cardiovascular event, for instance, and you get a percentage. And if you get a percentage, you can dial in this data from different pharmaceuticals, for instance, and a statin, or I'll eventually get to another one, but a statin for cholesterol, and you find that to prevent an event, you need to treat somewhere between 40 and 100, and let's say they've got a risk of 10%, you might be able to reduce that risk 2 to 3%, but you may need to, depending on what that risk score is, you may still need to treat 40 to 100 folks to prevent one event. So, there can be an argument made on either side there for, okay, is it worth it? Or there are some downsides of what happens in the body at a molecular level. There can be with some, and this can even be on, herbs and vitamins. Many things have the potential to help get the body better, it can be a dose thing, or reverse that process and work against what we're trying to do, which is create balance. But, in the case of a statin, or another big medication is called metoprolol, which is often used for atrial fibrillation, blood pressure. It can be used for heart palpitations, these types of things. That also is one that if you do a search, you can look up mitochondria and drugs that are pharmaceuticals that are hard on the mitochondria, and there'll be like a top 10 list. And so this is important that you always discuss this with your physician. Again, does the net positive outweigh the net negative? Because, again, all these things can all have side effects as well. Not only can they kind of irritate that mitochondria, but the mitochondria is the engine. It's the engine that we really get into immune health here as well. If the immune system gets sideways, many times if we bolster up that mitochondria, which we get from our moms, that's an inherited little bugger there. It's a little organelle in our cells, and it's a beautiful thing. And when we get good ones that we get from our mom, it's a blessing, because that means that little engine in there is fired up and cranking really good, and it's producing energy really efficiently. And that, when that's happening, many times a lot of things that we throw at it, toxins in the environment, different stressors in our life, we're able to keep up and overcome those things because that mitochondria is working so well. However, over time, and this is why we like to do measurements at the wellness clinic, such as the PNOE, we're able to measure that mitochondrial function. It's a 10-minute breathing test, measures your thyroid, measures your metabolism, and it also measures your mitochondrial function. So what we'll end up doing is for folks that come in, measure that score, and we'll check it again down the road to say, how are we doing at improving that mitochondrial function? Is it a 30%? Is it a 60%? And we talked last week a little bit about that 40% efficiency and effectiveness of mitochondrial function being a kind of a tipping point. We want to stay north of that and have it above that, and we're a lot less likely to have different conditions come on board that can be difficult on our bodies and then lead to poor quality of life, not thriving.
You know, one of the things in preparation for today's show, I watched a video on mitochondrial health, and one of the doctors basically went out to prove that it wasn't that big of a deal with his own mother, a very highly respected medical scientist, and did all kinds of testing, found out that indeed mitochondrial health was a monster thing in one's health, and found out his mother had what she determined and what she was diagnosed with, chronic fatigue for like 15 years. And he got to work on her mitochondrial health, and imagine this, the chronic fatigue went away.
Yes, and it can be dramatic that some, again, share that short story of the individual that has been with us a couple months now. When that mitochondria is not working, that a lot of times that pain and inflammation level are going to go up. And this individual, for 15, 20 years, he shared with me yesterday that he was in a position where he had pain throughout the day. And now, after we've worked on identifying detoxing his body, making sure bowel movements are happening, making sure that he's on the anti-inflammatory diet, and he's been working with us with prolozone, ozone injections, IV ozone, hyperbarics, meeting with Molly, met with Mychal, the whole team to work on essentially, getting that body back into balance and optimizing that mitochondrial function. So when he was in yesterday, he told me everything is on an upswing now, and he used to have, when he came in, his pain and aches in the joints and whole body were daily, all day, every day, throughout the day. And now we're at the point where he's like, it's mainly when he gets out of the bed in the morning, but it is something that after a couple of steps, it's gone. And so, again, we'll have to recheck his mitochondrial function a couple of months down the road here again. But my guess, Dave, is that we're going to see that score go up. And then when we kind of dust those things off and get them firing right again, if you use the engine terminology, you're changing the fluids on the engine and you're cleaning the carburetor, and that's ultimately what is the body as a human machine is this beautiful creation from the Creator. We're dusting off the cobwebs, and once we dust it off and identify those things that are stressing it, we get it essentially tuned up, and the body remembers the rhythm that it once had. It remembers because it's always working towards a state of balance and trying to get into a state of healing. The body is trying to protect itself, find homeostasis, and so if we can give it a little bit. I liken it to when you think of a dad or a mom, and you got the training wheels with little Johnny or little Susie, and we're there at the start here. When we take those training wheels off, we're a little bit wobbly going down the road. When we're given little Johnny or little Susie a push to develop enough momentum to the point where they start pumping those legs and they keep the momentum going. And then occasionally, they're still learning. They might fall over. And so we got to give them another push. And the same thing's going with what we're doing here on folks' journey is, again, we're, encouraging, we're giving that little push with these different, with these treatments, to identify where the impediment is in the block, in the healing process. And once we give that little push, that momentum is built up, the body remembers, and it can sustain in many cases where some of these things that we do with that little push on the front side, we don't have to do them as often. And in some cases, we get folks tuned up so well that they're able to manage with lifestyle and nutrition and exercise. And maybe they only come see us once and again if they kind of get off the side of the road in the gravel again and they need a recentering and a little reinforcement. But, that's the beautiful part of the process is there is so much that we as physicians and a medical community try to do to understand what's going on in the human body, what's going wrong when things aren't firing right. But I still think that there's so much that we still don't. We know a lot of basic concepts, and we're always learning. But that's what I've found here is that there are certain foundational approaches that support things, oxygen, mitochondrial health, immune health, that you give the body a little hormetic effect, meaning a little bit of a stressor sometimes, which could be a little ozone, and then that high-dosed oxygen, 3 oxygen molecules, stimulate a response in the body, and it was put in there by God to know what to do with that. It's like, here's a little push, and then all of a sudden, all these pathways happen that are like almost, do we fully understand? We have ideas in modern medicine, again, all about the Krebs cycle and all these biologic pathways, but do we know them to the complexity of how things happen to the letter that the Creator knows? Probably not, and we're always finding ways, but we have found ways. I think the greats in medicine are the folks that have been able, and in anything, to make the complex simple. So we try not to over complexity things, make things simple, and let God be God,
Yeah.
and that mitochondria that's passed down from generation to generation, from mom to child, get that tuned up and watch what happens.
We're out of time, but I just want to share with you again from this video I watched. The doctor explained the mitochondrial health as the batteries to your engine. And it was so good. It was like, we get these batteries up and running, then things all of a sudden, the body starts working like it's supposed to work, and we're seeing things like the chronic fatigue disappear. And I'm like thinking, how many people are out there suffering from chronic fatigue, thinking, wow, this could be the hope for so many people.
It's exciting, and it's a big mission for us to get the word out. And this is why, again, you see things happening across the country and world right now. We talk over the last 3 years, every year, more and more places are popping up that are looking at the terrain, looking at the mitochondria, looking at these engines in the body to get them firing better and doing things a little bit differently than maybe traditionally taught. And wow, yeah, I mean, folks that it's at some point it's like, wow, somebody comes in and says, I've been dealing with this for 10 to 15 years, and in a matter of 2 to 3 months, we're making progress that sometimes still even makes my jaw hit the floor. But it certainly is. It is a blessing to be a part of that, and then they go out and share the good news with their friends and family, and that's what it's really about right now is getting the word out, and that's the mission field of, okay, thriving every day. We want folks to know that you can feel better. There are ways. You don't have to accept that this is just aging, that this is my destiny. I have to go through this pain or this fatigue. You can take control of your life, and when you have the information to know that there are options out there that are there for you. But again, it's knowing and then deciding, I want to do something about it. And when you get to the point where, like, okay, I want to do something about it, and I know there's something to do, then let's do it. Let's get going.
All right, so if folks want to come over and hop on the bike, knowing that you'll provide the training wheels, how can they come over to Okoboji Wellness Clinic and maybe have a visit with you or a discovery call? What's the best way to go about it?
Yeah, all of us here, Mychal Sheridan, Molly, we all take complimentary discovery calls, and we all work collaboratively together. We're a team here, and we realize the body doesn't work in a isolated room. It's all connected, and so some folks really want to go through and work with Molly to start. Some want to work on what's called reflexive brain work with Mychal to start, or they want to do a discovery call with me and get going on the journey. And any of us can be a touch point. We all communicate and talk about the journey of the guests that come here and work on, hey, what's the next pivot we need to make. But yeah, it's a complimentary phone call, 712-339-6024. And we're at 3305 Berquist Avenue in Spirit Lake. We're just off Highway 71. And that's why I say, encourage you to make your story the next hope story at Okoboji Wellness Clinic, because it can be you.
Absolutely. Thrive, not just survive. Very good. Dr. Meyer, a pleasure as always. Have a great day. We'll chat again soon.
Thanks, Dave.
Thank you.
Bye-bye.
Dr. Bradley Meyer at the Okoboji Wellness Clinic. And you can find out more online as well, okobojiwellnessclinic.com.